Initiation of peripheral intravenous therapy and intravenous medication administration.
Hi, good morning. My name is Nurse Marks, and this morning I'll be inserting an IV and administering some IV medication that the doctor has ordered. But before I even begin, let me go ahead and perform some hand hygiene and put some gloves on, and then we can verify that I'm with the right patient. I already washed my hands outside. Okay, I see here, I can visualize your ID band. Can you tell me your full name? Miley Cyrus. Great. And can you also tell me your date of birth? April 1st, 1990. Very good. Thank you. I see here you have an allergy bracelet on. Can you tell me what you're allergic to? Sulfa? Okay. And what happens to you when you take sulfa? Your throat closes up and you get hives. Okay, thank you very much for verifying all that information. Alright, so I have verified that you are the correct patient based on your patient identifiers. I gathered all my equipment to start the IV, but first I'm going to provide privacy. And I'm going to go ahead and reposition your bed to provide for good body mechanics on my part. Let me know if at any time you're uncomfortable. The IV medication that I'm going to be administering today is called furosemide. You may have called it Lasix before. It causes you to pee, or urinate rather, and the action is to pull extra fluid from your vessels and possibly your lungs. Sometimes when you have swelling in your legs or some shortness of breath, this medication helps to clear that fluid. I've checked your potassium level. It's within normal range because Lasix can lower that, so I checked to make sure that was good. And then also your blood pressure is within normal range, so Lasix can also, or furosemide can also affect that, so I made sure that that was within normal range. All your other vitals are also within normal range. I just want to ask you, are you experiencing any pain? No, not at this time. And are you in a comfortable position? Yes. Okay, great. So at this time I'm going to go ahead and expose your arm so I can take a look to see which veins would be best for me to use. We usually like to use the veins in the hand first because they're most distal, and if anything goes wrong we can move upwards along your arm. Are there any contraindications to me using your left arm? No, it's okay. That you didn't have any special surgeries or implants? No. Okay, great. Thank you. I'm going to open my IV kit. And I'll be putting an elastic band around your arm. It's called a tourniquet. This just helps with venous engorgement so I can visualize those veins. Okay, I think I found one. That's good to use. Let me go ahead and loosen the tourniquet. Alright. So now I'm going to go ahead and prepare my flush and my IV catheter. Any questions so far? No? Okay, good. I'm using a 3 ml syringe to prepare my flush, and I'm attaching my blunt needle, making sure the hub of the needle remains sterile. I have here normal saline as my flush. I'm going to scrub the top of my vial, and I'm going to go ahead and displace 3 mLs of air so that I may pull up 3 mLs of saline. It's a blunt, clean needle, so I can recap. Now I'm going to connect my flush to my tubing. Again, making sure not to touch the tip of the tubing. And I'm going to flush for patency and to make sure that it's completely primed. I'll then loosen the cap at the end of my tubing to assist with application. Okay, this time I'm going to reapply the tourniquet. It's going to be a little tight. Let me know if you're uncomfortable. And I'm going to ask you to just hold your hand as steady as possible in place. Okay, let me go ahead. I'm going to clean the site. Alright. I also have here extra gauze pads in case of any small amount of leakage. Okay, I'm removing the cap from my catheter, and with the bevel up, I'm pulling the skin taut, and I'm going to, you're going to feel a little pinch. Okay, I've inserted my catheter almost halfway. I've watched for blood return. At this point, I'm going to go ahead and extend the catheter with my forefinger all the way and pull back on the needle until I hear the safety latch snap in place. I'm going to go ahead and apply my gauze pads to catch any possible leakage. At this time, I'll remove the tourniquet and I'm going to connect my tubing. A little blood at the site is okay. Fortunately, I have extra gauze. Miss Cyrus, are you still comfortable? Yes? Great. Okay, at this point, before securing, I'm going to flush to check for any signs of infiltration. There are none. So I'm now going to go ahead and secure the site with my op-site dressing, making sure to cover the hub of the tubing as well as the entry site of the catheter. Miss Cyrus, you're doing great. I'm going to remove my flush, clamp my tubing, and then I'm going to use 2 pieces of tape to secure my line. One to anchor the hub of the tubing, and another to secure the other end. Okay? At this time, I'm going to go ahead and dispose of my equipment and clear up the site, and then I will deglove, perform hand hygiene, and label your site. And on that label, I'm going to place my initials, the date, and the gauge of the needle. Any questions? No? Okay, great. I performed hand hygiene. I had my pen already out, and we'll write today's date, my initials, and gauge. And I'm going to make sure when I place the label that it does not occlude the off-site dressing, so we can always visualize the entry site for any signs of swelling, redness, or infection. Okay, great. You tolerated that very well. So now I'm going to move to the second part of our planned procedure today, which is medication administration. I've already verified your name and date of birth and your allergies. I also verified or checked the MAR against the doctor's order. And now I'm just going to go ahead and verify the medication against the MAR, against your name and date of birth. Okay, I have here 20 milligrams of furosemide to be given intravenously stat to Miss Miley Cyrus, date of birth April 1st, 1990. That's all verified. I have the correct medication here, so now I'm going to go ahead and get ready to pull up my meds and give it intravenously. Any questions? No? Okay. Let's perform hand hygiene just one more time. And I'm going to don a new set of gloves. I'm sorry, what was that? You take furosemide at home, so you know all of it. Okay, great. So this is not the first time. Well, having it done intravenously, it might take effect quicker than the pills. So, you know, if you feel like you need to go to the bathroom right away, just let me know and I'll be here to help. Okay, so we've got a nice brand new IV site. I'm going to be using my 3 ml syringe to pull up my furosemide and my 10 ml syringe to pull up my flush. This way I don't get my medication and my flush mixed up. So first let me go ahead and pull up my furosemide. I'm going to use the same technique when connecting my blunt needle, making sure the hub remains sterile. And it's 20 milligrams in 2 mLs, so I'm only going to displace 2 mLs, even though I have a 3 ml syringe. Okay. Pulled up 2 mLs. I'm going to recap. Again, it's a blunt needle, so I can recap. And now I'm going to pull up my flush. And I'm going to go ahead and scrub the top of my flush, and I'm going to be pulling up 10 mLs. This is to provide for flushing before and after medication administration. And I'm going to be administering my furosemide as indicated by the drug guide at a rate of 10 milligrams over 1 minute. So first let me go ahead and scrub the hub of your IV loop. Open the site, and I'm going to go ahead and flush slowly with just about 3 cc's, 3 mLs of normal saline. How are you feeling? Okay? Great. Alright. Now that I've verified patency once more, I'm going to go ahead and I'm going to administer the medication. Let me know if you feel any discomfort. So I'm administering this over approximately 2 minutes because it's 2 milliliters, 20 milligrams. Okay, how do you feel? All right? So that was 2 minutes. And now I'm going to flush at the same rate I administered the medication. I'm going to flush with 3 ml, so that's another 3 minutes. Great. How are you feeling? Good? Okay. I'm going to go ahead and reclamp my tubing, dispose of my equipment and garbage, and reposition you to a safe position. I'm going to reinforce the instructions that call for me if you need to go to the bathroom. And let me know how you're feeling. I'll probably do another set of vitals when I come to check on you in 15 minutes. Do you have any questions? Great.
Right to the second. Great. It shut right off. So I was like, oh crap. 15 minutes and 20 seconds.
Awesome.